Hey everyone, welcome back to our channel. My name is Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbamboo.com. Before we get into today's video, I wanted to share something that might be helpful to you along your dementia caregiving journey, and that is the Treehouse. The Treehouse is an all-in-one dementia care library that offers practical education and resources that extends beyond what you see here on YouTube. Of course, as with all of our content, our goal is to help you feel more prepared and confident along your journey. So if that sounds helpful to you, you can check it out and learn more at letsbamboo.com/treehouse. Also, you can watch all of the content that you see here on YouTube as well, but ad-free. So you clicked on this video because you want to know how fast dementia progresses. And first, I'm going to tell you something you don't want to hear. And that is, there is no real way to predict how fast dementia will progress. It's different for everyone. Now, with that being said, there are some factors that we know can impact the speed of progression, okay? So that's what we're going to focus on for this video. But this will not be all-inclusive, meaning there are other factors outside of what we're going to talk about that can also impact the speed of progression, okay? So the first factor is the type of dementia. For example, Alzheimer's disease tends to be one of the most slow progressing types of dementia. Even though the average life expectancy is anywhere from 3 to 11 years, there are people who live 20 years or even more with Alzheimer's disease, whereas Creutzfeldt-Jakob disease tends to be one of the most fast progressing types of dementia. The average life expectancy is 4 to 6 months after the onset of symptoms, and the majority of people will pass away in a year. So as you can see, there is a range. The second factor is age. So there is some evidence that the symptoms of dementia tend to progress slower in those over the age of 65 than those under the age of 65. So unfortunately, those with early onset dementia tend to experience faster progressing symptoms. The third factor is comorbidities, meaning any other medical conditions that coexist with a diagnosis. So if the person has other health conditions such as cancer, heart disease, high blood pressure, diabetes, especially if those conditions are not well managed, those conditions can contribute to the exacerbation of symptoms and the progression of dementia, okay? And then the fourth and final factor that I'll mention is acute medical events. So these are things like delirium, infection, fall and head injuries, fractures, especially hip fractures, and surgeries, especially if they require anesthesia. All of these things can contribute to the exacerbation of dementia symptoms. Now, some people with dementia will bounce back from these things, but for others, you will notice that they are then at a new baseline and then they continue to progress from there, okay? But I just want to re-emphasize that everyone's journey with dementia will be different and everyone will progress at a different rate. So please don't get too caught up on the rate of progression or life expectancies or anything like that, okay? If anyone has any questions, please don't hesitate to ask. And if you're looking for more guidance or support along your dementia care journey, please feel free to visit us at letsbamboo.com.